They told me I would never move my wrist again. Hi, my name is Betina. A few months ago, I had re-injured my wrist at work. I was unable to rotate my wrist, move it, and do everyday things without pain. I went to an orthopedic surgeon and he explained to me the only thing that he will be able to do was a total wrist fusion. The idea of me permanently losing the movement of my wrist scared me, and I decided to get a second opinion. That's when I met Dr. Michaeli. He listened, he explained to me that instead of doing a fusion, he would do a wrist denervation and RPNI. After my surgery, the recovery went smoothly. Now for the first time, I'm able to move my wrist, bend it, without pain. I'm so thankful for Dr. Michaeli. He gave me my independence back and quality of life.
Hi, I'm Dr. Oren Michaeli. I'm a peripheral nerve specialist and also a hand surgery specialist. I originally met Betina when she was referred to me by an orthopedic surgeon for a wrist fusion due to chronic pain after a non-treated wrist fracture. When I saw the patient, we got x-rays and I saw that she had arthritis between the two bones over here, in what we call the distal radial ulnar joint, and she also had arthritis between the radius and the carpal bones, which are the bones of the wrist. She was unable to do this effectively, nor was she able to rotate the wrist. Typically, in her case, the arthritis was so advanced that we would do a wrist fusion, and normally we would connect the radius to the wrist bones, and that would stop the wrist from flexing. But in her case, because she also had distal radial ulnar arthritis, she would not be able to turn her wrist. So effectively, a wrist fusion for her would result in her only being able to do this, and she would be fixed in rotation and in flexion and extension. It was time to use a different train of thought and put away my saw aside and take a look at the nerves. What I thought would be best for her was to do a total wrist denervation. So what you end up having are the nerves in the hand that innervate the wrist capsule, which is separate from the nerves that innervate the muscles and separate from the nerves that innervate the skin. So we have a branch that comes off of the radial nerve on this side of the hand, one that comes off the ulnar nerve into this side of the hand, one that comes off the AIN, which is the anterior interosseous nerve on this side, and one from the PIN, posterior interosseous nerve, from this side. And what we did for her was I removed the nerves where they entered the joint, and then I took small little muscle grafts from the neighboring muscle bodies, and I formed what's called an RPNI, or Regenerative Peripheral Nerve Interface, to make sure that those nerves would never innervate that capsule again and cause that pain. And what ended up happening was fantastic. Within a couple of weeks of her surgery, she was able to rotate her wrist and she was able to bend it. For the first time in 2 years, she was actually able to use that wrist in an effective fashion.